Hello colleagues and welcome to today's webinar on NCFE's approach to COVID-19 adaptations for qualifications with mandatory or significant workplace components. My name is Paul White and I am the Head of Provider Development at NCFE. I am joined today by Juliet Mears, our Lead External QA, and Jackie Vincent, our TQ Chief Moderator. The purpose of the session today is to share with you the approach we will be adopting to the adaptations of our assessments as a result of the COVID-19 pandemic and the associated restrictions. The aims for the session are to set the scene in terms of the external environment and the extended extraordinary regulatory framework. We'll set out how we have approached our response to the EERF. We'll summarise our current assessment approach and the changes we are proposing to our qualifications with mandatory or significant work placement components. We'll provide you with a brief demonstration on how to access all of our COVID-related documentation. And finally, we intend to signpost you to further support you can get from NCFE Cash. Throughout the webinar, you will be able to post any questions in the chat box, and we'll then update our master Q&A document and provide a link to that in a post-webinar email that will be sent to the email address you registered with today. So let's first turn then to the external environment and the context of today's session. I think it's fair to say that summer 2020 was challenging for everyone involved in education. Whilst it was challenging for awarding organisations, it was an extremely difficult and testing time for our centres, and equally, it was incredibly unsettling for learners. Summer awarding 2020 was governed by the rules set out in the extraordinary regulatory framework. The ERF essentially resulted in centres submitting centre-assessed grades based on a range of evidence as opposed to the usual diet of exams and external assessments. Over the last few months, Ofqual have been consulting and issuing guidance on awarding for 2021. This has resulted in the introduction of the extended extraordinary regulatory framework, the EERF. Some of the key points to take from the EERF are that the government's expectation is that assessments should take place in the academic year 2020 to 2021. Where assessments and qualifications cannot progress as they normally would, awarding organisations must consider adapting their assessments and qualifications. Awarding organisations that have used adaptations to mitigate disruption during summer 2020 may also choose to continue to apply some or all of those adaptations in 2020 to 2021. The extended ERF gives a permissive approach to adaptation of qualifications and assessments for 2020 to 2021. This means we are not required to make adaptations if it is not necessary or appropriate to do so. Awarding organisations must have regard to the ERF guidance when determining which approach to take to their assessments and qualifications for 2020 to 2021. The Association of Colleges, Association of Employers and Learning Providers, HOLEX, the Federation of Awarding Bodies, the Joint Committee on Qualifications and Ofqual have committed to work together, convening a work group to agree how centre-facing communications can be streamlined over the current academic year. As a first step, they jointly agreed that by the 23rd of October, awarding organisations will have started to communicate to centres their planned approach to any adaptations to their qualifications for 2020 to 2021. This is to assist in mitigating disruption to teaching, learning and assessments so that as far as possible, learners have the opportunity to receive fair results in 2020 to 2021 and are not disadvantaged by the longer term impacts of the pandemic. NCFE published our blueprint and accompanying documentation in October under this agreed approach. We are delivering this webinar today as an additional resource to summarise the key elements of our approach to qualifications that comprise a mandatory or significant workplace component. Through the joint statement, the Working Party are strongly encouraging awarding organisations to keep their centres fully informed as plans develop, and the group will coordinate milestones and communications and address issues arising through the year. In this section, we're going to provide you with a brief demonstration to assist you in locating our key COVID documentation and also where you can find the appropriate adaptations to the qualifications we'll be covering today. So, as part of today's webinar, we thought that it would be helpful to give you a brief demonstration to show where to find the important information relating to not only COVID adaptations in general, but also those relating specifically to the program that you're running. First thing to do is to navigate to the NCFE website. The address is www.ncfe.org.uk. From there, at the top in the purple banner, you will see the link through to our COVID hub. So let's go there now. So in our COVID hub, we have all the central information relating to planning ahead for 2021. And let's go to the Adaptations section in the bottom left in orange. So first of all, in our Adaptations section, on the right-hand side here, we have a video which runs through our basic approach to adaptations and articulates our blueprint document, which was released 2 weeks ago. To see the actual blueprint document, this is in the bottom right-hand side of your screen in the purple box. So let's just have a look at that now. So this 12-page document sets out our blueprint and our approach for assessment adaptations. There's an introductory page, and then we set out the different types of assessment, the current approach, and our proposals for any adaptations for 2021. Feel free to download this and use it in your general guidance. Going back to the Adaptations Hub, in the center at the bottom, in the orange banner, we've got frequently asked questions. In this section, as the name suggests, you'll be able to find a list of all the questions that we're most commonly asked by centres with our reply and links to other information within the website if that's appropriate. Finally, in the bottom left, in the dark blue box, we've got our link through to QualHub. QualHub is where you will be able to find the programme and qualification specific information, and that's what I'm going to show you next. So we are now on QualHub, which is our central qualification portal, which stores all the key information about our qualifications. This webinar focuses in particular on those programs and qualifications where work placement is a mandatory or a significant component of the assessment for that qualification. So let's have a look at a couple of examples. First of all, we're going to look at our NCFE Cash Level 3 Diploma in the Principles and Practice of Dental Nursing. So we're now on the main qualification page. All of our qualification pages adopt a consistent approach. So there is a new button on the left-hand side, which is called Adaptations. If you click that button, it will take us automatically to the bottom of the page. There are a range of other icons here, which you're probably already familiar with, like the support materials, where we house our qualification specification, key facts, etc. What's new is on the left-hand side, you can see an icon and adaptations listed. So if you click on that, you get a short introduction and preamble to the context of the adaptation, and then the detail of the adaptation is available for download by clicking the green box. And what you can now see on screen is the Adaptation Addendum. Our Adaptation Addendums all follow the same format. So at the top, we set out the qualification reference number, the qualification title. Underneath that, you will be able to see in the left-hand side column, we set out each of the individual assessment types. So in this example, internal assessment. In the middle column, you can see we set out what our current approach is. And on the right-hand side, you'll be able to see the actual adaptation for this particular assessment type. Moving down the document, you will see if there are other types of assessment, like in this example, multiple choice and short answer questions. They will also be included in that adaptation using the same approach of setting out what our current approach is and what our future approach is. I'm now going to select a different qualification, which is Pharmacy, Level 3 Diploma in the Principles and Practice for Pharmacy Technicians. Again, the format is the same. Select Adaptations, and then select Adaptations again. Again, you will see the preamble. What's slightly different with this qualification is, as well as our adaptation, you will also see some further guidance based on joint collaboration with relevant sector bodies and other awarding bodies. So let's take a look. First of all, our Adaptation Addendum, which is in the same format as the previous one, with the qualification title and number at the top, then the 3 columns below setting out the assessment type, the current approach, and the adaptation. If we look at the second document here for download, this is a collaborative document that has been put together by all the relevant awarding bodies with their logos at the bottom there that you can see. And this sets out the assessment mitigation centre guidance for pharmacy qualifications. Hopefully you will have found that helpful, and you will learn more about these qualifications later on in the webinar. Thank you. Okay, I hope you found that little demonstration helpful. I'm now going to hand over to my colleague Jackie, who's going to take you through the qualification specific arrangements.
Thank you. As I'm sure most of you will be aware, many of the qualifications within the CASH brand include mandatory placement and the assessment of skills. These include those in the following groups: licensed to practice and registered professions, early years educator, including the early years practitioner, pharmacy, dental, and health and social care. We aim today to explore some of the methods of assessment that have been included in our adaptations documents for qualifications, including mandatory placement for the assessment of skills, and we will show you some published examples to familiarise you with the approach. We will also provide an overview of the methods included in the adaptations for further clarity. We would like to remind you that centres should now only refer to the published adaptations on Qual Hub and not the adaptations published for summer 2020 awarding. There are several points that will need considering when planning any adaptation of assessment. Centres should be permitting flexibility in placement hours. Placement hours should still be planned and documented clearly as required, but the focus is not on the hours or percentage of attendance, it is around the judgment of competency for the student over the time of study at the relevant level. If the student has not reached the level of competency required, then further placement will need to be scheduled at a later date, and therefore completion of the qualification will be delayed. Centres could consider block placement rather than weekly, especially for second year learners, and this will give all learners the best opportunity to meet the knowledge, skills and understanding of mandatory early years educator criteria if this is appropriate. Consideration should be on a case-by-case basis for progressing learners from a level 2 to a level 3 in early years, childcare or other qualifications in the same sector. Placement hours may therefore be reduced if this is the case, where learners have demonstrated level 3 skills or competencies within the level 2 qualification. It is suggested that 25% of level 2 placement hours can be considered for level 3 if this is appropriate. Observation continues to be the main and preferred source of evidence. However, the challenges faced due to COVID-19 pandemic have informed the adaptation addendums, and we recognise that if observations are permitted and can continue as expected, adaptations will not necessarily be needed. We would also like to take this opportunity to reinforce that ultimately the assessor must be confident that the learner is competent against all criteria, and that this remains the responsibility of the assessor and the IQA throughout any adaptation of assessment. Other points that will need consideration will be the review of policies and procedures, especially regarding assessment and IQA. It will be expected that as a minimum, you review and update your IQA strategy to reflect this increased risk that standardisation of assessment is also increased, enabling opportunity for the review of assessment processes for all of the methods used. Let's take this opportunity to review the methods included in the adaptation addendums. You will have noticed that each qualification now has a specific adaptation document, and Juliet will be taking you through some of these examples a bit later on. You will be familiar with most of these methods. However, we have provided an overview for each just to re-familiarise yourself with them. Again, where it is deemed safe and appropriate, observation continues to be the preferred method. It must be safe and appropriate following a robust COVID-19 risk assessment process. Direct observations of performance again remain the preferred method of assessment, but where it is not safe to gain direct observation of performance, the following approaches should be considered. A combination can be used to create a robust triangulation of performance-based evidence for the learner. So, what is the definition of triangulation? The triangulation of assessment is the considerations and practices of collecting evidence from different sources to inform and evidence accurate and consistent assessment decisions. In this instance, the assessor will collate evidence from the setting, the learner, and from any observation or simulation opportunity. The other methods typically used are expert witness testimony, professional discussion, simulation, and reflective account. Let's look at reflective accounts and professional discussion. Reflective accounts and professional discussion could be used to support other forms of evidence in this instance, but are not direct evidence sources which can replace the observation requirement. These can be used to support the triangulation of evidence. Centres are reminded that reflective accounts and professional discussion continue to be acceptable for assessing skills competence, and this is in addition to the triangulation approach. The use of simulation has been permitted in some instances. Some of those examples include in a childcare qualification, due to COVID-19, simulation has been agreed in exceptional circumstances such as making bottle feeds and changing nappies. In health and social care, examples could include hand washing. Please note, centres may only use evidence from simulated activity to meet assessment criteria where the relevant qualification specifically permits this, and this will be made clear on the adaptation. The use of expert witness statement will include planning the witness statement, induction to support and train the expert witness, the review of the centre IQA strategy. This will need to be adapted and it will need to focus on the expert witness testimony so that the process is standardised. An expert witness must have a working knowledge of the units for which they are providing the expert testimony. They must be occupationally competent in their area for which they are providing expert testimony. And they must either have a qualification in assessment of workplace performance or a work role which involves evaluating the everyday practice of staff within their area of expertise. We would like to take the time to consider the use of remote digital technology. As with all cash qualifications, the use of remote technologies could be considered to observe aspects of the student's performance where privacy, dignity, or confidentiality of any individual, service user, child or young person or family using services is not compromised. For example, this may include online meetings and remote activities in which the student is contributing and where the assessor could also attend remotely or observe through the use of technology. If the centre is using remote technologies, then there is responsibility to ensure standardised approaches are adopted and reviewed, which consider units and criteria of the qualification where this approach might be suitable. Video or the use of audio recordings, there are some restrictions. Confidentiality and GDPR. The following opportunities for the use of these methods might include planning learning sessions with the student, feedback with student, professional discussions, or sharing of workplace resources or work products. I'm now going to hand you over to my colleague, Juliette.
Thank you, Jackie. Let's take this opportunity to review some of the adaptations that have been agreed and are available on Qual Hub, following on from the demonstration earlier. Each relevant qualification now includes an Adaptations tab on the Qual Hub area. We will review examples of the adaptation addendums for placements from a selection of cash qualifications over the next few slides. Some of the information provided will seem repetitive. However, we feel that it is important to give you some examples to enable centres to feel more confident with the use of the adaptation addendums. In line with sector guidance, we will be continually reviewing these adaptations. It is therefore important that you check these regularly for updates. The early years educator group of qualifications includes the technical qualifications, work-based and other EYE qualifications. You will find the adaptations on the Qual Hub area. In each tab, you will find the Joint Awarding Organisation or Awarding Organisation Adaptation Guidance. This has been provided to ensure there is a standardised approach to the adaptation process. Each addendum indicates the qualification reference, title, and all the approved adaptations. For the purposes of this webinar, we will look at the adaptations for assessing competence of skills, usually assessed in the workplace or placement. So you can see for qualification 60126-292, the Level 3 diploma for the early years workforce, the addendum is as follows. So we are looking at what is the assessment. So observation of competence via workplace or mandatory work placement is essential due to licence to practice requirements in a given occupational area. So the current approach would be, many of these qualifications do currently require that students complete a minimum number of placement hours, often to meet those externally set licence to practice requirements. The amount and type of assessment included in work placement varies between qualifications, but will typically be a combination of internal skills and knowledge assessment activity. The adaptation is therefore shown as all relevant qualification content must still be delivered and assessment criteria met, where qualifications include work placements which are essential to student progression. We've worked with relevant partner organisations to determine the most appropriate adaptation. Wherever we can do so without compromising student progression or wider regulatory requirements, we will look to remove the requirement that students complete a minimum number of placement hours, permitting centre flexibility to support students' progress outside of the work placement, provided they demonstrate competence. Require that centres do still record placement hours in the manner they otherwise would for the relevant qualification. Encourage centres to use available flexibilities to capture evidence for students' portfolios. Work with employers to plan placements. Centres to have a strategy in place for reducing the risk to follow local protocols. Consider block placement rather than weekly, especially for second-year students. Assessors, tutors, teachers to prioritise observations during visits and make use of outdoor environments to minimise risk, especially in childcare. Create a bubble by using a single assessor, teacher, tutor for each setting rather than by student, which limits the risk and allows assessors, teachers, tutors to see more students during the visit. The adaptations then go on to detail the different methods of assessment, and as Jackie said previously, these include observations, expert witness testimony, remote technology, use of professional discussion and reflective accounts, and any approved simulation opportunity. And finally, some information regarding placement opportunities for students is also provided. We will review now the Adaptation Addendum for the Level 3 Diploma in Dental Nursing. As you can see, planning is key and particularly important in ensuring placement hours are planned in as normal. All relevant qualification content must still be delivered and assessment criteria met. We believe that the flexibilities which centres already have with respect to the types of evidence they may use to meet assessment criteria are sufficient to mitigate COVID-related risks. We would encourage centres to consider how they might use alternatives and/or digital solutions to gather and store evidence, including centre-set short response or multi-choice tests, professional discussions, annotated learning plans, photos and videos. Where it is not possible to use assessor observation in the workplace, then observation of some work-based activities may take place using remote technology. This methodology may only be used where the activities to be observed do not involve patients. In addition, the employer must have been consulted and provide consent. The use of remote technology to observe practice must be reflected in the assessment records. This must include justification for the use of the technology planning, acknowledgement of employer consent, and confirmation that no patients are involved in the activity to be observed remotely. Centres must always produce auditable records of the activity that was observed and the trainee dental nurse's contribution to that activity. We appreciate that to create and capture evidence for the skills aspect of these assessments, students may need to access specialist facilities or equipment. As our existing guidance permits, to mitigate COVID-related challenges in accessing facilities or equipment, we would encourage centres to consider, for example, the following: the use of expert witnesses, using observation of simulated activity, digital solutions to capture evidence remotely, and carefully consider how you schedule teaching, learning and assessment during the year, recognising that you may not be able to access the specialist facilities in all weeks. Here are some examples of where remote technology is appropriately included. Decontamination of equipment, setting up equipment or surgery prior to patient appointments, processing of radiographs, simulated activity where this is already part of the assessment strategy in the qualification. So we're going to look at one unit in particular, understanding first aid emergencies. For this unit, could consist of proof of training and first aid simulation as described in the unit, and professional discussion or question and answer to confirm the learner's knowledge, expert witness testimony or assessor observation records covering simulation of the competence assessment criteria. The First Aid Training Awarding Organisation Forum have provided additional evidence, and this can be found in the link in the adaptation document. Due to the nature of first aid qualifications, some elements of training and assessment must take place in a face-to-face environment. The practical skills in first aid are complex, and difficulties in online training and assessment will adversely affect validity, reliability and maintenance of standards. Furthermore, in the current pandemic, prominence must be given to ensuring first aiders in the workplace are able to provide first aid wearing the necessary PPE. So undertaking training and assessment wearing PPE is both appropriate and necessary. A blended approach to first aid training whereby the knowledge-based elements of the qualification can be delivered online whilst allowing sufficient face-to-face time to teach and assess practical skills. The Adaptation Addendum for Health and Social Care is slightly different than the previous examples, and you will see here on the slide a list of qualifications that are included. This means that the adaptation shown under each of these qualifications will read the same. Placement hours should still be planned and documented clearly as required as part of these qualifications. Where placement is not a mandatory part of the assessment or count towards the overall grade and cannot be accessed due to the restrictions of COVID-19 in the sector, this needs to be clearly documented, including the reasoning for non-completion. Additionally, placement hours may be reduced where learners have previously completed hours in the same sector with a level 2 health and social care qualification, as Jackie touched on earlier in terms of the EYE qualifications. Wherever we can do so without compromising student progression or wider regulation requirements, we will look to remove the requirement that students complete a minimum number of placement hours, permitting centres flexibility to support students' progress outside of the work placement, provided they demonstrate the competence. Require that centres do still record placement hours in the manner they otherwise would for the relevant qualification. Encourage centres to use available flexibilities to capture evidence for students' portfolios. Work with employers to plan placements, centres to have a strategy in place for reducing the risk to follow local protocols, consider block placement rather than weekly, especially for second year students, and encourage delivery staff to create a bubble by using a single assessor, teacher, tutor for each setting rather than by student, which limits the risk and allows the assessor, teacher or tutor to see more students during the visit. Observations. Competency-based assessment requirements must include direct observation of performance of the student as the main source of evidence. Where it is deemed safe and appropriate following a robust COVID-19 risk assessment process, direct observation of performance remains the preferred method of assessment. Where it is not safe to gain direct observation of performance, the following approaches should be considered. A combination can be used to create a robust triangulation of performance-based evidence for the student, as described earlier by Jackie. We have expert witness testimony, professional discussion, simulation, and reflective accounts. I will now hand you back to Paul.
Okay, thank you for that, Juliet. That was very, very comprehensive. So in terms of some of the additional information that we've referred to today, just going to go on to the next slide. We have provided some key links to many of the documents, guides and policies that we've referred to in today's webinar, including the blueprint document. So all of the links to key documents on the webinar will be circulated in a post-webinar email, which will be sent to the email address that you registered with today. So we're now going to cover a few questions that we have already received. Unfortunately, we already have received lots of questions. So the ones that we can't answer directly, we will get out with a link to the main Q&A document. But for today, I'm going to ask Juliet and Jackie just to join me again to support. So the first question I've got, Jackie, if I can ask you to pick this one up. If assessors are unable to access placement to complete observations, how will the observations be completed?
Thank you. So I'd just like to remind colleagues just to please check the adaptations update specifically for each qualification that you assess. For licensed to practice qualifications, registered professions and those with mandatory placement hours, the expectation is that learners still have access to placement. We are continually reviewing the current situation. If learners can access placement, the triangulation approach should be applied. However, if learners are not able to access placement, and this is a mandatory expectation, for example, in the licence to practice qualifications, then this will need to be delayed.
Okay, Jackie, thanks for that. So next question for Juliet. Can a setting record an observation for the assessor to then assess remotely?
Thank you, Paul. It remains that video or audio streaming or recording should not be used where this compromises the privacy, dignity or confidentiality of any individual, service user, child or young person or family using services as a method of gaining performance evidence. So again, it is clear in each of the addendums in regards to that. So just keep an eye on those.
Thank you, Juliet. Jackie, will the adaptations be reviewed again?
So yes, adaptations will be reviewed and that will be in line with sector guidance. And of course, any updates will be available on Qual Hub and will be communicated to centres.
Back to Juliet, I think. Is there a minimum expectation for assessor observations?
As we touched on previously, the observation continues to be the prime assessment method of performance evidence. However, we do recognise that there are ongoing challenges with this. The focus has moved away from the number of hours and specific guidance must be referred to for each individual qualification. For example, pharmacy qualifications do have a mandatory requirement for the number of observations to complete.
Okay, thank you for that, Juliet. So last question then, as we draw to a close. Jackie, do learners have to complete all criteria if they are unable to access placement? And can we use other adaptations?
So yes, all criteria must still be completed for all qualifications, and there needs to be a clear audit trail of the assessment process. Each qualification, as we've gone over, has an adaptation addendum, and this will confirm the adaptations and methods that can be used to assess competence. Some do have included examples where simulation can be used, but please be reminded that these can only be used where stated.
Okay, thank you for that, Jackie. So big thanks to Juliet and Jackie for supporting with that. So just a reminder to regularly check the COVID Hub on our website at the address below. If you'd like more information or support, you can email our customer support team at ncfe.org.uk or call us on 0191 239 8000. Alternatively, you can talk to your NCFE account executive. So thank you for listening to this webinar today. We hope that you found it helpful. Please be assured that we will do all we reasonably can to help, support and guide you through this challenging coming year. So from everyone at NCFE, thank you and stay safe.